I have
I'm
never
a
done this
little
before.
nervous. Neither have I.
So I'm Tim Pickett with UtahMarijuana.org and Utah Therapeutic Health Center. Welcome to our 1 year anniversary Facebook Live, YouTube Live event. We're pretty excited. I've got a special guest with me, really good friend of mine, Sierra Burt, one of our QMPs, who we're going to get to talk to and kind of spotlight a minute. But I really wanted to take this first couple of minutes and just say thank you to all the patients, all the people who have really made this possible. You know, a year ago in January, I started seeing people in a small little therapist office. Saw 11 people or like 17 people in January. And I think we saw 60 something people in February, and Sierra started then. And we have seen so much great response to the medical marijuana program in Utah. And the I think we have helped, and the response from the patients is that we've helped a ton of people. So we want to just, like, I just personally want to take this opportunity to say thank you to everybody who's made this possible, and especially really the patients for trusting us, trusting me in your care. Um, it's been a huge success, I think, for the first year. There's been some problems, and we talk about those on like the podcast I do with Chris Hollifield, Utah in the Weeds. We talked to a lot of people over the course of the year about all the hurdles that patients have to cross and the EVS system and all of these like crazy things that we've dealt with over the course of a year, right? Like it just doesn't even seem possible that we're here a year later. And we did all this, and you've done all this in a global pandemic. So like I don't even know how to add all that up, right? So I want to announce that we're going to do some giveaways tonight. We're going to give away a PAX 3 plus 2 free visits in our clinic. So a PAX 3 complete kit. You can enter on Instagram starting tomorrow in the giveaway post. The entries end on February 28th. So not too long, but we're going to take entries until then, and we're going to announce the winner on March 1st. Make sure to watch the stories this week and on Instagram, and you'll be able to comment, and we're going to give away some sneaky giveaways to the commenters and people who are active on that feed. So be sure to get involved in the conversation. We're also using this as a way to generate like what needs to happen in the clinic and in our patient care and for you over the course of the next year, right? So, um, yeah, exciting stuff. So, okay, let's get into Sierra Burt. So Sierra and I worked together for, I want to say 3 years. Was it that long?
Just barely that long. Yeah.
It feels like 10. Like it feels like we worked together for 10 years, but Sierra Burt, she's the first QMP to join Utah Therapeutic Health Center, right?
That's right.
In We were working in theory and method
That's right.
downtown, right? Like, so tell me what that was like in the beginning.
It was kind of fun because it was totally uncharted territory. I had never delved into the medical side of cannabis before. And so we got to learn alongside our patients. So that was really fun. We had quite a few walk-ins off the street. It
Oh
was
yeah, I remember sitting there, and we were the only place on the map at the
yes,
time, right? If you searched on Google Maps, that was it. We were it.
right.
And so we'd have
So
people walk in.
yeah, we'd have 4 or 5 people waiting in the lobby for us, and it was just the two of us. Like we didn't even
Yeah.
have Courtney join us, so we had no receptionist. It was just us.
Yeah. And,
saying, come on in, we'll get to you when we can.
and we thought, like, I really thought, oh, this is going to be great. It's going to be this nice little boutique kind of thing.
Hmm.
And we got to spend time with people and we had to kind of do it all, right? But we were writing
Yeah,
letters. This was before the EVS
true.
system was even up and running, right?
That's right.
Um,
So patients would come in, we'd see them. But I remember, when COVID was first hitting, we had to think, okay, how are we going to formulate a letter to put on the door saying, like, please be respectful to everybody and don't come in if you have flu-like symptoms?
I know that was, yeah, that really changed everything
It did.
for the whole place. I mean, I remember the therapist there and us starting to get really concerned, but really not knowing what to do,
Yep.
right? Like here we are, middle of March, we're busy. The doors
Hmm.
really blew off in March, though, right? Like we
Yeah.
had Courtney, we had my two sisters answering the phones from Washington and from Farmington. Like it was just kind of out of hand. Dragonflies open. We're trying to do
Right.
these letters, trying to
Yeah.
figure out the system, the EVS system.
Which we crashed several times.
Right, which yeah, didn't work at all in the beginning. Um, do you remember like I remember the patients. Do you remember a specific like story that you really remember from that period of time?
Um, I remember a couple of my first patients, quite a few people that served in the military. And those are kind of my favorite patients to help in this industry, just because their stories are so crazy, the things that they've experienced. And sometimes they go into detail and sometimes they don't. Um, but having not served in the military, I can only imagine what they've been through. And sometimes it's PTSD, sometimes it's chronic pain just from the extreme things that they went through, like jumping out of helicopters. And some of them actually were shot in combat.
Right? Yeah, we had some people come in missing limbs during that time. We
And they weren't
had
shy
and
about showing their scars.
no, no, we have some um yeah, that's right. And they had been using the thing that I remember a couple of things the most is one being so nervous as a provider like in this field to give somebody a recommendation for cannabis. That I really remember being quite nervous about that in the very beginning because it was new. I really wanted to do it and I believe in it, but still as a provider, you're doing something that's federally illegal,
Right.
right? You're recommending somebody go out and use a Schedule 1 substance equal to heroin on the
Right.
federal level.
100%.
Yeah, I remember some sleepless nights at the time thinking, man, what have we like what are we really getting in ourselves into liability wise as providers?
Right. I mean, this is our livelihood, that we
Right?
work really hard for. We went to a lot of school, and
Yeah,
here we are kind of chancing it.
sure. Do you the on the other side, I feel like I learned more from the patients. Don't you feel like in the beginning, especially, you really learned from these people that were using cannabis? Like these people knew more than I did.
100%. We had a patient with MS that came in that was talking about her Rick Simpson oil. And I actually had to do a quick Google on my computer and I was like, what is this?
Right? Yeah.
And it wasn't available in Utah until really recently.
Right. It was just, in fact, I think it was been just the past month or two when there's been a
Yeah.
couple of drops of Rick
Yeah.
Simpson oil. We've had a
Yeah.
lot of questions about Rick Simpson oil in clinic recently.
Hmm. Yeah.
Um, and, now we kind of understand things a little bit better. Uh, do you feel like you've kind of dialed in the treatment?
For sure. And it definitely depends a lot on the patient conditions as well as patient age, patient comfort level. Some patients want nothing to do with something that you inhale. And whether that's for health reasons, such as like their lungs, things like that, with religious reasons, So it's been really fun to be able to dial in the specific dosing for patients.
Do you feel like have you had patients come back and get good advice at the pharmacy? Do you feel like, I don't know, I'm kind of switching gears here to talk about the pharmacies, but
Hmm.
what do you think how do you feel about the way the pharmacies have developed and like the advice they're giving your patients?
I think most of the patients have been definitely benefited from meeting with a pharmacist, even if it's only for their first time. That and the bud tenders being able to recommend specific, um, you know, this tincture works great versus this one, and this is a full spectrum versus this is just CBD or just THC. I think the
Yeah.
employees at the pharmacies have been fantastic.
Has working in this space changed what you do in surgery, like changed the way you advise patients?
100%. So when I first started working with you about 3 years ago, I remember we would prescribe about as many narcotic pills of Percocet that insurance would cover, and
Oh yeah.
I've
I,
literally
I
kept
mean, I
that.
think I was the one who taught you that no, Walmart will cover 45 Percocet
Yep,
fives
yep,
or 42. It was 42
42.
Percocet. Yep. They'll cover 42. So just write the max.
So that's what we would write for. And now I send my patients home with, depending on the surgery, usually 10 to 14. So I've literally quartered what I used to prescribe to my patients because I see just how tortured some of these patients are. They're like, oh, yeah, I had a dental procedure, and that's what got me hooked on narcotics. Something as simple as like, if I help take someone's gallbladder out and I send them home with a crazy amount of Percocet, am I going to be responsible for causing that addiction or that discomfort?
Yeah, I remember when I started. So I did surgery. I did GI surgery for 6 years, and when we started, I was taught to prescribe 65 Percocet fives for a gallbladder surgery. And like you say, now we're down to 10, 15
Yeah.
Percocets, just a few days worth,
Hmm.
and that like now. Did you know 70% of our patients use less medications now because they use cannabis? Like
I
we've
love it.
surveyed all these patients. When I posted that, and I saw that you saw it on Instagram, 73.3% of our patients, and the number is 2,800 people that have responded to that. Like that's a huge
Amazing.
number.
Yeah.
And I can't figure out why we haven't as a nation like got this into the hospitals yet.
Really, though. I've had patients contact me knowing that they're going to get another surgery. I'm like, hey, I've struggled with narcotics in the past. I've been full blown addicted in the past. I don't want to take narcotics. How can I dose my cannabis in order to
Ah,
completely avoid even picking up that prescription? And I talked to them afterward, and they say their experience with cannabis was even better than with the narcotics.
so I've had the same experience. I had a patient that got in a traumatic accident, busted up their face, didn't want to take any Percocets or anything.
Mhm.
They went to the ER, got a head CT, and didn't want to use any of that. So they used some tincture at night, Tylenol and ibuprofen. And
Mhm.
my recommendation to this patient was, I think you should take some Percocet. Like literally, I was like,
Oh no.
you banged up your head pretty good. Like Percocet is a reasonable medication right now.
Mhm.
But they didn't want to do that. They used tincture at night. They used a little bit of a vape in the daytime. They were able to get sleep, which I think was the key to that patient not using any narcotics.
Mhm.
And I think if patients can, this is just my opinion, but I think that the pain keeping you up at night and keeping you from getting some rest is a key component.
Absolutely. It prevents healing if you can't sleep.
Do you think this brings up this question of like, do you think that they will add any, um, diagnoses to the list?
I really hope that they do. And now that we've kind of hit the 1 year mark, I'm kind of curious to hear what's in the works.
Mm-hmm.
I tell my patients, even though anxiety and depression aren't qualifying conditions, I always document it in my note in the clinic because I would like to see that data of all the patients that will benefit from it. Or
Yeah.
same thing with when they come back for their 6 month visit and they say, you know, I'm actually sleeping way better and my appetite's improved. I just feel way better.
Yeah.
So
So you're talking about using the data that we gather on actual use,
just to,
because let's say you
yeah,
qualify for pain, but you're using it for anxiety as well, right?
right, right.
And then and then over time we could figure that out. We could give the state that data and say, look, of
Hey,
the
like back it up.
right,
Right.
yeah, people are really getting a benefit from anxiety. I think sleep disorder would be a really good one.
Mhm.
I think anxiety's tricky. I don't know, because I've had patients come back and had to relearn. We've had to really talk again about the dosing and adds a
Mhm.
lot of CBD because the THC makes them a little more anxious.
Sure, sure.
So I don't know about anxiety. I think one of the things I'm afraid of with the new legislation where they're going to allow 15 cards to any provider, no education at all. And I'm kind of afraid that if you don't have any education with cannabis, then you're going to I mean, you don't know what your patient's going to go take. And
Exactly.
there and I think people have better experiences if they're managed by somebody who like knows
Mhm.
a little bit,
I agree
right?
100%.
Like educated.
Well,
Do you feel like
and the
that?
more patients hear it, hear it from their QMP, and then they hear it from the pharmacist, and then they hear it from the bud tenders, and then they go online and watch like your YouTube channel. I feel like the more you hear it, the better it sinks in and the more beneficial it is.
Yeah, brings a good point. So I'll plug it to the YouTube channel, Discover Marijuana on YouTube, where I'm doing these videos with Blake Smith. And in fact, I released one on Friday that was my own, just marijuana and sleep, and kind of just doing a little bit of research, just a no hype, right? Like, here's just some info on
Yeah.
cannabis, right?
Hmm.
Destigmatize it, like talk about it legit. Um, and I think you're right. If you get the information from your QMP, if you get the information from the bud tenders, the pharmacists, you're getting that same like reinforcing it, right?
Hmm.
Then you get permission from somebody, a friend or trusted. I like to think it's us who gives permission to people who to like experiment a little bit, right?
Yeah.
Um, then I think people have a better experience.
Right.
Um,
And the reassurances as well of, a QMP who has experience, maybe have dabbled in it themselves, maybe they're a patient themselves, being able to say, okay, if you take more cannabis than you should have, it's going to be okay.
right.
Find
Yeah,
yourself a dark
absolutely.
room, find yourself a snack, and just kind of let it run its course. Versus somebody else who maybe doesn't have that experience or the education or just the background would say, like, oh, yeah, go to the emergency department and here's a $500 copay at least
Hmm.
to put you in a cool dark room with a snack. You do the same thing.
Right.
So that reassurance of having somebody that at least has the experience, and even if it's just with other patients, I think that experience goes a long way.
Yeah. Do you have a favorite type of like condition or patient that you like to work with?
Um, the chronic pain patients, I feel like you see the biggest drastic life changes in those patients.
Hmm.
They're usually the ones that come back and can tell me, like, hey, I've significantly decreased my pain medication, or hey, like, I'm able to ride my bike every day again. It's things that people miss doing because of this chronic pain. And then on top of it, because cannabis treats so many different things, they're sleeping better, their inflammation goes down. Sometimes they lose weight just because they feel better and they don't have
Hmm.
those chronic stress hormones going.
Yeah. Interesting fact. Cannabis users are on average a lower BMI than
Mhm.
non-cannabis users. I don't know if I don't know it's if it's directly correlated or not, but it's just
Um,
a interesting little tidbit of
yeah,
information. Even though I think, and the data is mixed a little bit on weight gain with cannabis. If you're
sure,
using it for gaining weight, then it's pretty
sure,
effective, right? The
sure.
cancer
Yeah.
patients
Hmm.
has, we when I was doing both surgery and this, I noticed that it changed the way I talked to patients, but I still wasn't allowed to talk to patients because of who we worked for,
Right,
right?
right.
And do you see any of that changing in the near term?
I can hope so. That's the best answer that I have in regards to
Right.
that. You can kind of hint at things and you can make some suggestions. But of course, I am not prescribing or recommending at my surgery position because we work for a company based in a different state and they don't support cannabis use.
Mm-hmm. That's right.
Um,
Okay, so we got our first question. Carlos Lopez asked this question. There's this big debate on Delta 8 versus Delta 9. I don't know if you're following this much, Sierra, but used in different cannabis products in Utah's dispensaries. Delta 8 is organically produced by the plant in very low levels. And so Delta 8 in the products is cannabis derivative. It's a derivative
mhm.
of other cannabinoids. So uh, Carlos has heard Delta 8 is basically extracted hemp oil. So why are the prices so ridiculously high on buying Delta 8 hemp oil when in neighboring states it's sold for $7 to $10 per 1 gram cart? And Carlos, you have a good question. This is kind of the drama in the market right now. There are some people who really believe that Delta 8 is, like you say, not it's derived from cannabinoids, so it shouldn't be as highly valuable. Um, there are others who understand the processing and they think it should be as valuable. And so I would say the answer is it kind of is just like everything else. There is not enough variety and product in general. So all the product is just high priced. Delta 8 is less mentally psychoactive than Delta 9, the straight THC, and it does have value. So that doesn't really answer your question, but I think over the long run, the price will come down. Um,
I would agree with
especially,
that.
yeah,
This the supply and demand. I mean, how many growers are still getting off the ground, building new facilities, getting established? There just isn't enough product. I mean, remember back in, April, June, July when there was no flower in any of
yeah.
the
6 months ago, there
dispensaries?
is no flour in this place, and now at least you can go places and you can buy flour.
Yes.
Um, and like vape carts there's an abundance of vape carts, but not. Sometimes people are thinking, well, they're not the best vape carts. Sometimes people really love them. So I think, Carlos, you just got to wait. You just got to wait another year. I I continually try to remind myself of this. We waited 20 years for medical cannabis in Utah compared to California, who got it in 1996. If we got to wait a couple more years for the abundance to come, hopefully that's okay. It's not great for the patients, I guess, but
And think 1 year ago we had vape carts and flour, and now we have vape carts, flour, gummies, we
right,
have
yeah, we have
capsules,
RSO,
we have
right?
RSO now, tinctures. I
Mm-hmm.
mean, just and that's in 1 year.
Yeah.
So we can gripe about how Utah handled everything, but I think they've done really well adapting to the market. I feel like the companies have
Mm-hmm.
done very, very well, producing as quickly as they have. And then they have to get everything tested. There's multiple steps that go. It's not just, you cut the you cut the flower, you dry it, and then it's in the store. It has to go through a pretty strenuous testing
Yeah.
process as
Well,
well.
and this question I will ask. I'm doing so Discover Marijuana with Tim and Blake is doing a Facebook Live on March 4th. So Carlos, this is a question we're going to ask Blake Smith because he and Zion Medicinals, they make a significant amount of the Delta 8 that's in the market now, and we're going to ask him. So stay tuned on March 4th. I think it's 6 or 6:30 again, and we're going to do a webinar. And Carlos, I'm going to invite you to that webinar, and we'll get the answer from the horse's mouth. So okay, so Sierra, tell us a little bit about you. You know, how'd you get involved in cannabis?
That is an excellent question.
Like you're from Oregon, right? You lived in Oregon?
Yes, I grew up in Oregon. You know, dabbled in cannabis in my early 20s. And you know, every time my whole family is still in Oregon. So every time I go home to visit, you know, I see a pot shop on literally every corner. It's impressive.
Oregon has some really great product. They have like an overabundance of
Yes.
product, right?
Yes, there's definitely a price difference between Oregon versus Utah.
Yeah.
That being said, though, and this is kind of a tangent, I've been really impressed with how Utah has focused on the medical side of things. When I do go home and go to the shops in Oregon, it's all recreational. It's actually very difficult to find many products that have like THC and CBD, and even more
Oh, really?
difficult to find full spectrum products. So as
Interesting.
far as product preference, I would prefer the Utah products. You know, you get what you pay for. I mean, there's definitely some good products in Oregon as well, but I've just been really impressed with the availability of the medicinal side of cannabis use in Utah.
Do you have a favorite strain that you like that maybe is here or there
I'm not experienced enough to answer
that
that
have a favorite
question.
strain? I feel like the same way. Like my preference is like I want to know what they all feel like,
Right.
right? Like
And I never get the
as
same one twice. So it's really hard to pick.
yeah, to nail one down,
hmm
right?
I do like
I
the wedding cake strains, but
mm-hmm. And they've
hmm
had some of that here, I think,
Yep, a couple
haven't
times.
they? Yeah. Okay, so we need to give away something.
Yes.
Um, let's give away something. Are we giving away a t-shirt, Zach? Zach is on the back end of I can't hear Zach right now, but I know he's texting me, so we're gonna give.
I'd be here.
Oh,
There he
Yes.
is.
there he comes in.
T-shirts.
Zach, let's give away a t-shirt.
All right. I think let's give maybe the first one to Tyson Coons if he's here.
Tyson Coons. Here's a t. Now I'm gonna show you this t-shirt, Tyson. It's pretty cool. There you go. Here, let me see if I can make my screen better. My screen bigger. There you go. Healthcare to buzz about.
I love it.
I know it's the THC molecule with a couple of B's. UtahMarijuana.org on the back. That was pretty cool. There, we've got that. We've got a beanie. We'll give away a beanie next, and another T-shirt. And then let's bring me back down. Okay, so when the next question that we're getting a lot of is, when do you think we're going to be able to grow at home? I think it's going to be 5 years at least.
Unfortunately, yes. And I think it will go, it'll be a process of people in rural communities will be able to do that first before us in the city.
Right, like 100 miles from a pharmacy or a dispensary.
Sure,
I think that was Prop 2, right? with something like if you don't live within 100 miles, you
Right.
could grow 2 plants or something like that. I could see them
Right.
bringing that back. It's not,
Mhm.
just so everybody knows, that is not on the legislature's radar at all. You're not getting that this
Mhm.
year.
Yeah.
No way, in my mind, unless something drastic happens. I just don't see it happening. The growers, those are the guys with the money and investing. They're the guys with the lobbyists, those groups, and they're not they're not really excited about us growing, frankly, because they need to recoup that investment.
Right.
Another question. Okay, so long-term pain, best product for long-term sustainability for chronic pain on a 24-hour basis. We're both going to say the same thing on this one.
I like tinctures for
Yeah,
that.
tinctures. Tinctures for sure, right? They
Yeah.
last 6 to 8 hours. You
Right.
can dose them good. You can
Absolutely.
get CBD, THC combo.
Well, and it's not as psychoactive depending on the ratio that you get. So you can actually dose yourself and go to work the same day and
Right.
function.
Yes. If you get like a 10-to-1 CBD THC,
Mhm.
5 drops in the morning, or
Perfect.
5 or 10 drops, right? You're not going to get as you're just not going to get as high,
Right.
and you
You still
can
get the
go
relief.
do your stuff. Yes.
Yeah.
You're going to get rid of the suffering. Still might have a little bit of the pain, but get rid of the suffering.
Mhm.
Um, then what's interesting, and we interviewed on Utah in the Weeds, Dash from Boojum. They are mixing some of their terpenes in their tinctures and modifying the terpene profile
Mm.
to make them a little bit more sativa or a little more indica.
It's
And
fantastic.
so that's kind of cool.
Hmm.
Um, let's see. Oh, what would you say to people? Yeah, what would you say to people who are considering, who are like on the fence about a medical cannabis card?
To just do it. Like, worst case scenario, you've tried it and you know it works or it doesn't. And if you find that it's not as successful as you were hoping, talk to us before you give up, and so we can give some recommendations as far as changing up your dosing, changing up, um, how you partake. I think that's really important. Is some people, maybe they have a really not so great experience the first time because they do overdose themselves, or some people drastically underdose themselves. Um, you know, priming the pump, if you will. Some people definitely have kind of an empty endocannabinoid system that has to be primed before they start feeling the effects.
Yeah, I think you bring up a good like a good point of discussion that I run into a lot with patients that are older. And I
Hmm.
would say for a patient, like, look, I would focus this one on a patient that's over 55, up into their 70s, and I would say, look, if you're not sleeping good and you just want to try something, as QMPs, we can't like personally promote the use of cannabis legally. So I guess I'd be very careful. Utah Therapeutic Health Center would say, hey, this is pretty reasonable. Like it's just a reasonable product to give it a try compared to the benefits of other prescription medications and the side
Hmm.
effects of other prescription medications. That's what you've got to weigh, right? So I would say just be willing to have the discussion with a medical provider who knows what they're talking about cannabis, to talk about the what you're taking now, cannabis, the side effects of what you're taking now, the long-term side effects, the cannabis long-term side effects, and then just compare. It's make a good judgment with a healthcare provider, but don't not consider it because you've always not considered it.
Right,
Yeah?
right. And
Don't
and
feel
that's
like that's my whole job is just telling people
that's the
that.
beauty though. We see quite a few patients that are over 55 that some maybe they tried it when they were in their 20s, some they never have and they've been opposed to it their whole life. But they've tried all the medications in the market and they're tired of taking narcotics and they're tired of, the hangover that they get from their sleep medication. Um, So I think it's kind of a fun thing to decrease the stigma around cannabis, to just
Hmm.
have that conversation. And now that it is, medically legal in Utah, you can start talking to your friends and family about it and say like, oh man, like I got this and this is fantastic. For the first time, I can sleep through the night and not wake up at 3 a.m. and lay there for an hour and then maybe fall back asleep.
Right. Or take my Ambien and eat a block of cheese in the
Yeah,
middle of the night, or,
right,
be out. Yeah.
right.
Or
Yeah,
be asleep when you drive to work. Again,
absolutely. Like how
these things,
terrifying.
I know you compare gabapentin, Ambien, Percocet, Norco, like these are drugs
Right.
that I don't know. I think the trade-off is pretty clear. I mean, maybe I'm biased, but I think the trade I
Little.
think the trade-off's pretty clear.
Um,
Well, okay, so let's I'm going to recap because I think, we've done a pretty good job at the Facebook Live. I think this has been really fun.
yeah.
And I don't want, I mean, I could talk to you forever, but I think I'll remind everybody that, follow us on Instagram, utahmarijuana.org, online, if you want to find out more about Utah cannabis laws, all this sort of stuff. You can search us on YouTube. Discover Marijuana is the YouTube channel. Of course, Facebook. We're here. Sierra, you come see her in clinic. Um, and her schedule fills up pretty fast, so it takes a while to get into her. The if you want that PAX 3 complete kit, then be sure to follow us and uh, enter on Instagram starting tomorrow. Um, let's see. We'll announce the winner on March 1st. And we should give away one more thing. At least I said we were going to give away a beanie. This is the beanie. I wear this thing all the time. The nice thing about the beanie, and you know what? We're going to go a mug. We're going to give a mug with it. The nice thing about the beanie and the mug is you can take them to work. They're not like, this is not like you've got just some crazy, doing bong rips on your sweatshirt or whatever, right? These are
Mm,
subtle. You can take them to
professional.
your right professional. Yes. So we need a winner for for these things. We'll ask Zach
We're
who
gonna give
should
that
be the winner.
Carlos Lopez.
Hey.
Carlos. Yes. All right, Carlos, you're the man. You got a beanie and a mug. So we'll reach out to you guys and contact you on this sort of stuff. Again, utahmarijuana.org. Thanks for watching. Thanks for being here. Thanks, Sierra.
Thanks for having me.
Super, super good to see you.
You too.
All right, everybody. Stay safe out there.